Welcome back to the McMaster Demystifying YouTube channel. Today we will be discussing a very serious and important topic focusing on women's mental health and abortion procedures. Abortions are a very common event in many women's lives during the reproductive years. It is estimated that 56 million abortions occur each year globally, with a rate of 35 abortions per 1,000 women within the age range of 15 to 44. Abortions affect roughly 25% of all pregnancies around the world. These statistics highlight just how essential these procedures are for women's health. Now, you might ask, how are abortion procedures defined and categorized? Abortions can be classified as either medical or surgical. Medical procedures can be conducted up to 10 weeks during the gestation period and include the use of medications such as mifepristone and misoprostol to block certain hormones needed for pregnancy, such as progesterone, to expel the embryo. Surgical procedures can be further classified by uterine aspiration and dilation and evacuation. Uterine aspiration can be completed up to 14 weeks during gestation by either electric vacuum or manual techniques. Dilation and evacuation can be conducted after 14 weeks gestation until approximately 24 to 26 weeks as the pregnancy advances. Now, let's dive into some research. In young individuals, studies have estimated that 40% of women under the age of 25 will experience psychological distress after an abortion, and more than 50% of individuals would prefer to have follow-up services regarding their psychological symptoms. Now, let's look at a study conducted on university students between the ages of 18 and 35. In this study, 89 females that had experienced an abortion procedure reported symptoms of grief and PTSD lasting an average of 3 years. Within the same study, the researchers also found that these women that had experienced an abortion were twice as likely to develop depression and substance abuse disorders in comparison to women that had a healthy pregnancy. Now, if that wasn't shocking enough, in another study assessing the predictors and development of post-abortion psychological distress, researchers found that it is very common for women to experience feelings of sadness, regret, loss, suicidal behaviors, anxiety, depression, and alienation from others. In this study, the researchers also concluded upon 12 risk factors for the development of adverse psychological reactions following abortions. 1. Commitment and attachment to the pregnancy. 2. Perceived coercion to have the abortion. 3. Significant ambivalence about the abortion decision. 4. Putting great effort into keeping the abortion a secret for fear of stigma. 5. Pre-existing of trauma. 6. Past or present sexual, physical, or emotional abuse. And then 7, unresolved past losses and perception of abortion as a loss. 8, intense guilt and shame before the abortion. 9, an existing emotional disorder or mental illness prior to the abortion. 10, appraisal of abortion as extremely stressful before it occurs. 11, expecting depression, severe grief or guilt, and regret about the abortion. And 12, belief that the abortion is the same act as killing a newborn infant. Through going over this list, it is quite evident that it is highly likely for an individual to experience at least one of these risk factors, therefore possibly developing adverse psychological reactions toward the abortion procedure. It should also be noted that factors such as negative stigma, incorrect education, coercion, guilt, shame, and fear regarding depression and grief symptoms make up 6 out of the 12 experiences. These 6 factors are shocking as they are caused by negative societal views, beliefs, and pressures which can be changed. Now, let's get into treatment options. So unfortunately, treatment options for psychological effects of abortion are largely understudied and unreliable, but luckily new research regarding cognitive behavioral counseling and hope therapy has recently gained interest. In one study regarding the beneficial effects of cognitive behavioral therapy, the researchers conducted a randomized controlled trial studying 168 post-abortion women in Iran. Now, what is cognitive behavioral therapy? This technique can be defined as a goal-oriented psychotherapy that attempts to identify and change negative behaviors and thought patterns in individuals. So, this study investigated the effectiveness of cognitive behavioral counseling on mediating symptoms of anxiety, depression, PTSD, and grief. The results revealed that cognitive behavioral counseling, when completed for 40 minutes each week for 6 weeks, reduced post-abortion grief intensity and can be used to reduce symptoms of psychological disorders associated with abortions. In another study also done in Iran, researchers used hope therapy as a means of minimizing adverse psychological symptoms associated with abortions in women aged 16 and older. So what is hope therapy? Hope therapy is a combination of solution-oriented cognitive therapy and narrative therapy that can be broken down into two stages: hope building and hope increasing. The researchers found that after 8 45-minute sessions that occurred twice a week, individuals showed a significant improvement in quality of life and psychological well-being. So where do we go from here? Well, extensive research still needs to be conducted to further understand the mechanisms in which abortions impede women's mental well-being and ability to flourish. Also, raising awareness regarding this issue will hopefully reduce the negative stigmas surrounding this complicated public health concern. And finally, creating more impactful public health policies and benefits surrounding this issue, such as providing essential resources like proper care/counseling and having the ability to get protected time off work. Thank you so much for listening, and we can't wait to see you again on the McMaster Demystifying Medicine YouTube channel.